Life is getting a little easier for expectant moms.
That's right. Now, there's one less thing to worry about when you go to your doctor, and NBC Health on Your Side reporter Cynthia Newsom is here to tell us all about it. It's a big deal.
It is a pretty big deal. You know, with all the aches and pains and doctor's visits and all the medicine pregnant women have to take, life is complicated. They don't need any more complications. So one of their pet peeves is having to wait to see the doctor while the nurse goes on a hunting expedition for their medical records. That's where a new system called eNATAL comes in.
LaVon Haggins is pregnant with her 6th child. She knows all about the medical record runaround.
Well, the record's not being available once I've reached the hospital, or having to sit and wait for the records to get there, or a procedure having to take place, and then the records coming after the fact, which is very trying.
It looks like things are going well today. You're about 12 weeks.
Now, LaVon's records are online. OBGYN doctors at St. Luke's Women's Clinic simply point, click, and type.
It allows us to have all the information on the patient in a central system. And the real key, as I said, is it allows us to have access to it whenever the patient comes in.
Dr. John Miller, a former OBGYN, designed the eNATAL program.
As information is put into the system, it helps the doctors and the nurses identify where the problems are, what the patient may be at risk for. And it helps design a care plan for each individual patient.
That's a real peace of mind, knowing that it's already there, it's just a finger click away. So it brings a lot of peace of mind.
And if you're out of town, any doctor with access to the internet can get the code for your medical records and log on so they get the full medical history. And in 5 years, electronic medical records will probably be the standard. So things are starting to change and get easier for OBGYN people and also, regular